Good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today, as usual, is Dr. James Bridgers, our Acting Health Officer, and Dr. Earl Stoddard, who is Assistant Chief Administrative Officer. Today as well, we have Department of Environmental Protection Director Adam Ortiz joining us as a guest. Reporters, all of you should have already permission to record. If you do not, please use the chat to request it. And with that, good afternoon to you, Mr. County Executive. Please unmute.
Thank you all. Yeah, good afternoon, and thank everyone for joining us for our weekly press briefing. As we're ending the month of October, we're in a lot better place than we were at the beginning of the month. This is good news as our families prepare for Halloween activities and other signs of fun activities over the coming weeks. It's good our numbers are looking better. And as you can see from the graph of the statewide COVID cases since the beginning of the pandemic, it's important to note that we're nearly in the same place in terms of cases as we were at this point last year. But last year we were on the beginning of an ascending curve, and now we're at the on a descending curve. So this is definitely a better place to be. It's interesting because we have vaccines and we have such a high rate in the community that we still continue to get a fair number of cases. We've made progress to reduce our positivity rates, transmission rates, and case rates that we saw spike again in August and September. But I remain concerned that we could be heading for another spike in our numbers as the weather gets colder, activities and gatherings move inside. This virus continues to mutate. We already know there's something that I guess it's Delta 4.2 that's in England. Even with all the improvements, this pandemic is not behind us. This week, Goucher College released a poll of Marylanders that asked recipients when they thought they would be able to return to normal pre-pandemic lives. Almost 75% thought that normal is not coming within the next 6 months. Some thought between 6 months and a year, other thought, after a year, and some thought even farther out. So it's going to, 16% of those folks didn't think we'd ever return to normal. I think a strong majority of Maryland residents understand that we need to remain cautious, and this attitude has helped us do better than most around the country. Our test positivity today is 1.36%. We have a case rate of 6.4 per 100,000 residents. Yesterday, we had 67 cases, including 3 hospitalizations and 1 death. So you can see that hospitalizations and deaths still aren't behind us. As you can see from the map, we have the lowest case rate in the state. We're at 6.4, Howard County's at 6.49, and Prince George's County is at 8.01, and then everybody else in orange and red. And I'll note that I guess it's Garrett County in the far west has a rate that's almost 12 times our rate. So obviously not following rules and taking this too lightly has pretty serious consequences for your population. We're fortunate that people here have been compliant with what we've asked them to do, and that certainly made the difference between being where we are and where some of these other counties are. According to the CDC criteria, we've been in moderate transmission category now since last Thursday. Today is the 7th day with moderate transmission, triggering an end to our indoor mask mandate. Yesterday, the Board of Health voted to end the mandate at 12:01 a.m. on Thursday, October 28th. So the mandate ends tomorrow. I want to remind people that any business or entity that serves the public can still require indoor masking if they wish, and they have the right to refuse entry or service for lack of compliances. Businesses are also free to require vaccines for entry. People should continue to wear masks in public indoor areas, even people who are vaccinated. Indoor masking is still required in our schools and on public transportation. And finally, wearing a mask indoors and in large gatherings is still not a smart thing to do, and safe health practice. And no matter what the health regulations say, especially for those who are unvaccinated, you should still take the most cautious path you can. Remember that though the mask mandate is lifted, we're still seeing more than 50 cases in some days. People are getting exposed to COVID, which goes from person to person contact. And this has been the case from the beginning. So the less person-to-person contact we have, and the contact mediated by masks has helped us all along keep the COVID number down, and it'll continue to help us in the future. COVID's definitely not over, and we shouldn't act like it is. That will only put more people needlessly at risk. I want to thank everyone for the vigilance and adherence to our guidance, and that's allowed us to get back to moderate transmission. As you can see from the CDC map of the counties across the wide swath of our country, very few are in the yellow or moderate transmission rate like we are, particularly jurisdictions as large and diverse. It's very hard to find yellow on this map because there isn't much of it. And those jurisdictions that are not yellow are jurisdictions that did not take the steps that we took to try to keep people safe. I think the proof of our effectiveness is in maps like this that show just how different we are. And because this isn't magic and there's no secret sauce in Montgomery County, it's basically we had a set of rules that kept people safe and people took those rules seriously. In terms of vaccination rate numbers, 77% of our total population is fully vaccinated, 85.5% have at least one dose. 91% of our eligible population, those 12 and older, are fully vaccinated. 99% received at least one dose. This number seems to be accurate. It's what the CDC is reporting. We know their numbers include more people than are in the state numbers, because their numbers include people who got vaccinated out of state, and they reassigned those cases to the state that people lived in. Whereas Maryland's is only based on the Immunet system, which only captured the vaccines given in the state. Now, this eligible population is going to change as soon as 5 to 11-year-old residents are included. So when you see a drop of 90, we will definitely be below 91% and 99% when we include 5 to 11-year-olds, but it's not because we've changed the data, it's because we've changed the number of people who are in that category. And so there will be lots of new people added to our measure of who's eligible once the youth vaccines begin. On Monday, I got my Moderna booster shot. I originally received the one dose of Johnson & Johnson. I'm feeling fine, no side effects. My arm got a little sore the next day, but nothing that was really discomforting. And I'm glad to have the extra protection. I encourage everyone who's currently eligible to receive a booster to please go out and get one. We now have the supply and distribution system in place to get this shot if you qualify. The vaccines are here, they're available, and they're easy to receive. And as was announced last week, you do not have to receive the same vaccine as you received originally. The FDA and the CDC have determined that booster shots are safe and effective after a thorough and independent and transparent review process. Pediatric vaccines. I know this is a big issue for lots of people in the county and for our school system. We're already preparing for pediatric vaccination of our 5 to 11-year-old kids, which could begin as early as next week. Earlier this week, Governor Hogan said the state would be ready to administer the vaccine to kids if approval occurs this week. The county HHS is expecting over 13,000 doses initially, and our first shipment, that will be out of almost 40,000 doses that are coming not only to our HHS department, but also to other providers within the county. So there'll be lots of providers that'll have these doses available, and this isn't the end of doses. There'll be more doses following on. HHS is working with our healthcare and school partners to provide vaccinations for the 5 to 11-year-olds. Following the CDC authorization, we expect that there will be many resources. Pediatricians can get the vaccines, pharmacies, community clinics. People are encouraged to check with their pediatricians and monitor the updates from the county on the timing and locations where vaccines will be available. And now I'd like to turn it over to Dr. Bridgers and Dr. Stoddard. And after their presentation, we'll come back to hear from Adam Ortiz.
Thank you, Mr. County Executive. Just a couple of updates to add to what County Executive Elrich presented during our numbers. We continue to see an uptick in our booster vaccinations at our 3 local health department sites. Again, we have over 215 sites that you can identify in the county. We continue to vaccinate our homebound individuals based on data that we have during the initial round of them, those individuals receiving their vaccine series, either Johnson & Johnson, now Pfizer and Moderna. Just a couple of numbers, as Mr. Elrich indicated, we continue to trend in a downward trend with our case rate and with our test positivity. I will be sending a letter over to the County Council, sitting as the Board of Health today, identifying and notifying them of that data trend, which will rescind the Board of Health regulation at 12:01 a.m. In the morning. The other piece is around hospitalizations and weekly data. Over the past 4 weeks, we've had 2,212 individuals hospitalized cases. Of those, 97 were hospitalized, which is 40% of those cases. We still continue to see the case count high in our Black, non-Hispanic, and our Hispanic population, where our Black population has the highest percentage of case rates based on those cases that have been reported over the past 4 weeks, which is about 48.3% of those cases. Conversely, our Hispanic population has about 13.8 hospitalization rates. Regarding our breakthrough cases over the past 4 weeks, we've had 909 cases. 37 of those breakthrough cases have been hospitalized, and we still continue to see the highest case rate per 100,000 in the age group of 40 to 49, which were 184 cases per 100,000. Now, transitioning over to our pediatric vaccination planning, as Mr. Elrich indicated, we have been planning for this time since July, mid-July, and we have a very fairly robust plan in place. I'll quickly just go over some of that proposed planning. We will continue to operate our community sites. In addition to those providers that Mr. Elrich indicated, we have over 112 providers, pediatric providers in the county, excluding our pharmacies and our hospital system providers who will have access to pediatric vaccines. We will continue to run our community sites with extended hours, Monday through Friday, for our pediatric vaccinations. Our booster shots and our initial series or our vaccination clinics will be open Monday through Sunday as they've been, but we've carved out a time throughout this period to vaccinate our 5 to 11-year-olds. The clinics will be open for pediatric dosages only 4 to 8 p.m. Monday through Friday. Pivoting to the weekend, we will have our MCPS partners come online, and we will operate 10 to 12 sites using a cluster paradigm, where we will have at the middle school will be the principal site for those clusters, using our equity framework, which we know we've been able to access and put more shots in arms through individuals throughout the county. Each cluster site will have 3 to 5 elementary schools in the region, so that we can access those students who walk, who take the bus, who walk or bike for them and their parents. These will be operated from 9 to 6 p.m. on the weekends. And we have our community partners who will also support our efforts in those times and spaces that we aren't in our elementary schools or our middle schools vaccinating our students, in those opportunities where they will be in those places. So we will continue to vaccinate throughout the week, throughout the first 3 waves, which is what we have been identified as being those heightened periods where we will administer pediatric vaccinations to our unvaccinated school population. I will stop there, subject to any question, and I will turn it over to Dr. Stoddard for his remarks.
Good afternoon. I only have a few additional comments. So as you will have likely seen yesterday at the county council sitting as Board of Health meeting with Montgomery County Public Schools, we did talk about the fact that we will be launching a test to stay pilot later this week. We're going to have a formal announcement with MCPS over the next couple of days on that. So more to come on that, but I wanted to make sure I addressed that. I know that there's been a lot of public interest in us doing that, and that'll help us reduce the quarantine numbers that we're seeing in our school systems, which are actually already quite improved from what we had at the beginning of the school year. A couple things I wanted to really highlight and sort of tie into what Dr. Bridger said is, number one, our goal every week is to distribute the vaccine doses that we get from the state of Maryland to our 5 to 11-year-olds as quickly and efficiently as possible. Our goal each week is to have zeroed out that number before we receive our next shipment. And so we will be doing that through a host of modalities that Dr. Bridgers has described, largely through our middle schools, because they have the actual space and infrastructure at the buildings to effectively support a hub and spoke model of vaccinations. We're obviously keenly aware of the fact that we have to keep kids continuing to be educated while at schools. And so many of these hours are going to be at nights and weekends, affiliated in the communities that they're meant to serve. And one other piece that I wanted to make sure that we highlighted is the fact that we are working very closely with MCPS to identify those students who have already been known to have immunocompromising conditions that make them presupposed for the more severe COVID complications, and they will be an initial target of our vaccination campaign with the 5 to 11-year-olds, because obviously they are at the most risk for those severe complications. And so those are the only few things I wanted to highlight as a sort of a support to what Dr. Bridges and the county executive already provided. So I think we're ready to talk about the wonderful work of our DEP director, Mr. Ortiz.
We're transitioning to you, Director Ortiz. Good afternoon.
Good afternoon. It's great to see everybody, and great to be part of this briefing. I usually get the notes afterwards, but I see so many friendly members of the press, and I just have so much gratitude to all of you for covering the work of the county, and particularly our environmental initiatives. But I don't want to steal the show. Marc, I'm going to follow your lead.
I'm going to hand this back to you in a second, but I just want to say, first of all, I want to thank you for the work you did. I wanted you to join us today, so I had this opportunity to publicly thank you for your service to Montgomery County over the last 3 years, and wish you the best of luck as the first Marylander to serve as an EPA regional administrator of the Mid-Atlantic states. It's good to have somebody who knows the environment in the specific location where you've been working for years. And I think this is going to be, a great step for President Biden, and I think it's a great opportunity for you. And I'm confident that you're going to be able to provide the leadership that we need. I do think it's a big victory for the environmental community. It's nice to know that an environmental position at the presidential appointment level is being filled by somebody who deeply cares about the environment. During my victory speech, when I won this job in November, I talked for just over 20 minutes about the environment and combating climate change. Giving a speech is one thing. I then had to figure out how do you put together a team that would demonstrate how crucial making progress in this category was going to be. And there was one person I wanted who I knew, because I knew you before. I knew the project that you had earlier done, and I was intrigued by it. And I didn't know if I was going to be able to pry you away from Prince George's County, but I apparently was successful in attempting in that effort. And I'm glad I was able to do that. My direction to Adam when he came to work for Montgomery County was to do what was right and needed for our environment, and not what was simply politically expedient or easy. I didn't want stuff written with anticipation of objections, because then what's written doesn't really tell people the true scope of what we need to do. I wanted the ability to present to people what needed to be done. And I think all discussions about this have to start with what was needed to be done. And I appreciate your willingness to do that. You had the right temperament, leadership skills, and passion, and you were able to achieve. Under your leadership, we got 2,000 trees planted through our Tree Montgomery program, nearly a 4-fold increase over what we'd done before. We moved several flood control and stream restoration projects into construction. We proposed and oversaw passing of the first national bill banning the use and sale of No. 6 polystyrene food service products, and passed a ban on plastic single-use straws. We launched commercial food scrap recycling program enlisting 24 partners for food scraps diversion for composting, started a single-family residential food scraps recycling collection pilot, which will be expanded, and launched curbside recycling purity program, where inspectors went out, inspected the state of trash that was left on the side of the road, and told people that their state of their trash was not adequate and they needed to clean it up. And that reduced contamination and recycling by nearly 50%, which shows that doing that was effective. Recently, the Department of Environment created Critters in Crisis list that establishes a local at-risk endangered species stream critters list to bring awareness to the water quality of Montgomery County streams and the impact of fertilizers and overdevelopment. And you led our efforts on reducing energy use that is saving us money, engaging residents, laying the foundation for us to achieve our climate action plan goals. You grew commercial building benchmarking, increased it, and it's led to estimated utility cost savings of more than $3 million for county commercial building owners. A few months ago, you succeeded in getting the council to pass the International Construction Green Building Codes, which is no small thing. I don't think you can underestimate the impact of that going forward in making sure that our future built environment is not our current built environment. And tomorrow, the council will be holding a work session on our building energy performance standards that would implement building energy performance standards to address climate change on buildings that already exist. And just to be clear about this, there is no achieving any climate goals if the existing built environment is unchanged. If inefficient buildings are allowed to remain inefficient, if they're allowed to be powered by natural gas or anything else of the polluting nature, there is no getting to zero. There's no getting close to zero. So this is absolutely critical. Adam's going to go in more detail about this. So I encourage you to cover this critical piece of legislation that will be historic for our state in achieving our climate goals, and to remember the work that Adam and the rest of our team put into getting this to the finish line. You helped implement an equity lens for all our environmental work and developed an equity map to assist in evaluating our processes to address innovation and equity in program delivery and community engagement. And you'll find equity front and center in our climate plan, literally front and center in our climate plan. So your appointment, I think, is another example of the caliber of people we've been able to bring into the county government. Although we'll miss your leadership and your innovation inside county government, I'm happy that you're going to be working for the local environment as our region's EPA administrator. So I'm going to turn it over to you, but just thank you. Thank you for persevering. It's been a good ride, and I'm looking forward to what you can do at the federal level. I would like to have some of the federal shackles removed so that the rest of us can do our jobs even more effectively. Thank you.
Thank you, Mark. Well, I'll get back to you on that last point. There's so many things I want to say, and I don't want to repeat a lot of the things that the county executive said. But I just want to first express my gratitude to him. He reached out to me early on. I had no interest in leaving Prince George's County at first, but there were a variety of factors, but not least of which was Marc's enthusiasm for the work and the belief in doing the right thing for the environment, and that promoting the public good is not always easy. And sometimes you have to benefit the future by making tough decisions in the present. So, Marc is so fearless about it. And I say this a lot, but the environment to him is always co-equal with all the other issues that are facing local government. A lot of us in this field and you members of the press know that environment makes great talking points. Everybody loves the environment. But in fact, it often takes a backseat to so many other issues like public safety and education and economic development. And those issues are absolutely important. But Marc realizes that they're co-equal, and he's willing to put it front and center. He's willing to use the bully pulpit and to make tough choices for the progress that we absolutely have to make. And in the environmental field, in a lot of ways, we're undoing 400 years of pollution, of industry, and trying to get it right, that we can still be prosperous, we still can be successful, but we can also be environmentally sustainable and promote public health. So I just want to first express my gratitude to Marc. And on Monday, I'll be sworn in as the regional administrator for the Mid-Atlantic region for EPA. I'm honored to have the confidence of President Biden and his administration, and I don't take it lightly. I will say that I struggled with the decision to put my name in for this position, just because I've loved working in Montgomery County so much. It's just such a supportive environment, to express yourself as a public official and to try to do good things for the environment. And we're joined by amazing colleagues, Dr. Bridgman, Dr. Stoddard, Patty Bubar, who's our deputy at DEP, Cindy Pena, who's our communications manager. Folks are so dedicated and we do great things. And under Marc's leadership, it was clear to me that my job and the job of the Department of Environmental Protection wasn't just to, follow the rules, and wasn't just to, implement the policies and push paper and do inspections and build projects, but our job was actually to lead the way. We're blessed and privileged in Montgomery County to have so much political support from the executive, from the county council, who've been great partners, from so many advocacy groups, and with a very, very talented and sophisticated staff. And with all those blessings, and few jurisdictions can say all those things, it's our job to take some chances and to do some tough things and to lead the state and lead the nation. And throughout my 3 years here, I've received many calls, I've been in many meetings, and I've been in many public hearings for the Maryland General Assembly, because they're like, so you guys are trying this plastic bag thing in Montgomery County, how's it going? Because we want to do something similar at the statewide level. You guys are doing something interesting on stormwater and a stream restoration. We want to do that at the state level. So they're listening, and they've listened even more. And during the General Assembly session, I spend almost as much time preparing for briefings and hearings in Annapolis as I do for our own county council here. And that's a testament to the leadership. There's a few things that are on the docket, and Marc mentioned some of the things that we've done. There's no need for me to repeat any of that. But tomorrow, the county council will hold its first work session on building energy performance standards. This is a great example of all these things. We'll be the first county in the United States to require energy efficiency standards for existing buildings. Half of all greenhouse gas emissions come from building energy usage, and half of that, about 25%, a quarter of all emissions, come from commercial buildings. And we know that's where we need to start, because there's a few thousand commercial buildings, and we know where they are. We know the managers, we know the owners. We can work with them over the next 13 years to get their emissions down to zero or close to it. And we have to do that because that's where we can make the most difference. So this will be a little bit tough, but our department has engaged opponents, or formerly opponents, stakeholders. We've engaged advocates. We've done a lot of public education, because we know this needs to be an open, transparent, and engaged process if we're going to succeed. So I'm really, really excited about that. Another major initiative that we put together, but we still have to get off the ground, is community choice energy. To the earlier point about us being the leader, the Maryland General Assembly wanted to enable counties to purchase their own green energy for residents. Currently, our utilities do that, and that can be okay, but jurisdictions sometimes have more aggressive goals and different environmental priorities than others. So it was debated by Delegate Charkoudian. She was the leader in the House of Delegates, and there was a lot of pushback. But in the end, she said, if anyone is going to do this, it's going to be Montgomery County. So I'm just going to try to get enabling legislation just for Montgomery County to be able to do this. And without any hesitation, the county executive said, yes, we're in. And he and I went to Annapolis, we testified, and we got that bill passed. And now we're in the process of developing the rules with the state of Maryland to be able to do that. Again, first, and people are watching us. So I can go on and on. There's lots to talk about, but I'm really, really excited that what modest contribution I have made has been done with a team of super talented people all around me. It's in really good hands. Adriana Hochberg will be the acting director, and she and I have been working closely, so everything will be handed off, and I have full confidence with her and the staff to get other things across the line. And there's a lot more coming. I'm tempted to talk about some of the cool stuff that we have up for the next few weeks, but you're going to just have to tune into Barry Hudson and Scott Peterson and Marc Elrich, because there's some really other cool policy that we're going to be introducing, again, first in the nation. So I want to end where I began, just my gratitude for the opportunity here. I'm going to take the lessons, everything that I've learned to know that we can get things done when we focus with the right leadership. And we have the right leadership in Montgomery County. We have the right leadership in the White House. We have the right leadership at the EPA to make a meaningful difference for people, even when it's hard. So thank you, Marc. Thank you to all my colleagues, and thank you to all my friends and colleagues in the press.
Thank you, gentlemen. Thank you, Director Ortiz, for your service in Montgomery County government. And now let's transition to the Q&A portion of this presentation with the members of the media. Dominique Maria Bonesi, you're number one. WAMU, good afternoon. And I believe you have questions for Dr. Bridgers and the county executive.
Thank you. Yes. Hi, Dr. Bridgers. How are you doing today?
Hi, Dominique.
I had a question regarding the moderate transmission rate, and just what do you think the county could attribute to that moderate transmission rate? I mean, it does seem like a bit of an anomaly in this area, in this region, on the East Coast. You also see Howard County that didn't have a mask mandate, and Prince George's County that had a mask mandate. So what do you attribute that sort of moderate transmission?
So great question, Dominique. So I can attribute that to what we continuously see in the data and our numbers as being reported as those individuals who are getting vaccinated, who've gotten vaccinated. But we have individuals who are very educated and informed. They ask those questions. They want to know if there's any hesitancy or apathy. We've provided the information. We've provided that through our PIOs and through other community organizations. We've established trusted and respected places in the county to continue to get our countyans vaccinated. And so when we look at the data, we know that when we look at the case counts and the test positivity rates, we have consistently remained lower than the other counties. We've worked with those counties to kind of assess, looking at those border counties, since you mentioned Howard and Prince George's County, to look at those individuals who may reside in the county or close to the county to ensure that we have plans and communications with them to get folks vaccinated who may work or live in one of those counties. And so I can attribute much of that to our county's tenacity and ability to come out and get vaccinated, to continue to ask those questions, and in some cases raise those questions that we are prone to answer.
And then I also was curious to know about the vaccines. Sean O'Donnell earlier this week said 3 to 4 days after the vaccines come out. You said early next week. Just looking at when you think early next week means. I'm just looking for more specifics.
So again, great question, Dominique. We received a range, so there isn't a pinpoint. We've been saying the week of November 8th. The range is 1 to 5 days after the vaccines are approved. So we don't know, based on those transportation means from the state to us. So that's why we've been trying to provide a range. So whenever we get the authorization, typically it's a range, especially when there's a new version of the vaccine. As you recall, if you recall, when we started vaccinating countyans, we would get the notification on a Friday, and we wouldn't receive the doses until that Monday, and either administer doses, have shots in arms that evening, afternoon, or the next day. So that will be the case during at least the first 3 weeks of us receiving our pediatric vaccine. So it could come the next day, or it could come in 5 days, and that should include the weekend, but that's the range of receipt notification that we have.
And then last question, just finally, how will the department be communicating with parents the safety of the vaccines for kids?
So we're working with our partners and our public information office to have messages. We will be using WhatsApp and other media platforms to get notification and information out regarding the efficacy of the vaccines and those places where they can receive vaccines. We're also working with our pediatric partners to get vaccines out in notification. They are also contacting their patients as well. And then lastly, our community partners, we're working with them on the messaging. Again, we want to maintain those trusted and respected places. We also understand that we are vaccinating a younger population, and so parents will be instrumental in getting our 5 to 11-year-olds vaccinated, to ensuring them that the vaccines are safe and that, that there won't be any fears from getting a shot.
Thank you.
Thank you so much, Dominique. Next set of questions, Brian Rembom, MarylandReporter.com. Good afternoon, Brian. You need to unmute.
All right, can you hear me now? Sorry.
Yes.
Just a quick question for the county executive. There's roughly 11 hours left of the mask mandate. What would you say to people who might say, look, I'm vaccinated, the mandate's coming off, I'm not going to wear a mask indoors? What would you say to them?
Well, it's not like we've been locking up people and putting them away for doing that. Obviously, there are people who haven't listened. I would just say, like, if we've gone through all this time, just wait the thing out. I mean, that same logic could have been applied to yesterday or 5 days ago or a week ago. I mean, at some point, this isn't hurting anybody. Some people act like this is a major imposition on life, and that's just absurd. So they should wait.
Okay. Thank you, Brian. The next question, Steve Bunnell, Bethesda Beat, for all officials.
Good afternoon, everyone. Mark, a little bit of a different subject here. The county council approved the appointment of Carol Rubin to the planning board yesterday. I know, obviously, I don't imagine you have any problem with that appointment. Can you just talk about your experience working with her? My brief research is that she's kind of been a mainstay working with the planning board staff and county government in general for much of her career.
She did really good work on the I-270 495 issue. Is the most recent work that I've done with her. And I'm not going to veto the appointment.
And then for the health officials here, Dr. Bridgers, it's interesting, I was listening to the letter you're going to send over to the Board of Health, but you used the word, I want to just make sure I understand, rescinding the health order. And I want to make sure, because my understanding was there's the chance of, if we have 7 days of 75 cases or more a day, that would re-implement the mask mandate. So can you or others just provide clarity? I just want to understand from the legal perspective, and God forbid we shoot up in cases again, how that'll work.
So Steve, great question. So I have to go back after this press conference and read the letter, but basically it's a notification to council that given the Board of Health regulation, we have reached our day 7 mark, and that's notification that that we've been in a moderate transmission, category, and as of effective 12/01, the Board of Health regulation will end. Now, whether or not it's rescinded, I don't have the exact language before me, but it means that it will end at 12/01 since we've reached 7 consecutive days of moderate transmission.
We did speak with the county attorneys and actually attorneys for council staff as well. And the understanding that all the attorneys have is that the mask mandate will end at 12/01 tonight, but the order itself doesn't self-terminate, meaning
Correct.
Dr. Bridgers would still be obligated under this order to provide notice to the council of any change in the transmission levels per the CDC. And so if we did go back to substantial transmission, he would be required to notify the council of that under the existing order, and that would re-trigger the mask mandate, the mask requirement. And so I do know that there are some council members who are discussing the possibility of changing that. It has not been proposed yet, but obviously, as it stands right now, the Board of Health regulation does still require the health officer to make those notices on a daily basis of the case counts, but more broadly on the requirement to notify them when we go into any change in transmission levels.
I appreciate that. To add on, it has to be 7 days of, it can't just be 75 or more cases in a single day, and that it'd have to be a 7-day period. Am I understanding that correctly?
Yes,
That is not my understanding of the order, but we can certainly review. My understanding was if we move between the categories and once we reach substantial transmission, there was not as I recall when we first triggered this, there was not a 7-day period of seeing substantial before it was triggered on the first occasion. But we'll certainly go back and look at that, Steve.
Right. Right, Steve. So I have to go back through it again,
Right.
Steve, as Dr. Stoddard indicated. So whether or not there's 1 day or 7 day on a daily basis, what we know is absolute. I will continue to notify council sitting as a Board of Health regarding the case rate. And so as soon as that case rate goes above that threshold, they will get yet another letter notifying that we have moved into another category.
Okay, and I guess even on a broader scale, I think Earl was getting at this, that the CDC changes its guidance, somewhat throughout this whole pandemic. Is it your guys' kind of opinion that the metrics of the CDC are still going to be the Bible when it comes to mask mandates and, things along those lines, I guess, just in a broader sense?
Well, in a broader sense, Steve, we continue to use the CDC as a guidance based on their metrics, since they set the policies for many of the activities that we monitor, as far as childcare settings, school settings, the types of occupational underlying health risks. So we still can continue to use them as our guided measure. Now, whether or not that will change, that's yet to be determined. Now, regarding the case rates, we hope that we continue to trend downward, and nevertheless, we will continue to use the case rate. But right now at the federal level, and they have multiple data feeds, we use the state data feed and we use what CDC is guiding. And in many cases, when we have questions about the data or questions as it pertains to Montgomery County, we have vetted those through MDH up through the feds to make sure that we are providing the best and accurate information to Montgomery Countyans.
Last question about vaccines. Obviously with the rollout hopefully happening for 5 and 11-year-olds and boosters happening right now, might be too late, frankly, but is there any interest, I know Gaithersburg has a local election coming up, in terms of, setting up shop when people are out going to vote. It seems like maybe a good idea to, grab those people while they're out already, but I don't know if there's any restrictions there, or just kind of wanted to ask about that.
So Steve, we've had conversations with the Maryland Department of Health regarding mobile vac teams, and that's a great idea. We're looking at those spaces that we know that folks may be going out in the community as we've done before. We started off with our initial county-run sites, and then we expanded it to the providers. And we know that pharmacies and hospitals had doses along the same time that we have. So we will continue, and we continue to look at those spaces where we can get those shots into the community. The question came up yesterday, I think, by Councilmember Rice, and looking at those zip codes, 5-digit zip codes as opposed to 4-digit zip codes, where we know that folks may need greater access. And so we factor that into not only our equity framework, but also our access framework, so that we can get those mobile teams into those areas. So that would be a great example of one area where we would send a mobile team to vaccinate or administering boosters to anyone.
Thank you, everyone.
Thank you, Steve. Next set of questions, Bruce Leishon, WUSA 9. I don't know if I pronounced your last name correctly.
Bruce Leishon, thanks so much.
Thank you, Bruce.
No problem. So, Mr. County Executive, I'm thinking you must want to congratulate the people of Montgomery County that this mask mandate is a sign that folks are dropping the mask mandate. It's a sign that people are paying attention and being cautious.
I do. I mean, I've been very laudatory of the people here because the only way this works, since we didn't, arrest people or do any of the scary things people were worried about, this was voluntary compliance with things that were meant to keep people healthy. And we've been very, very lucky. The thing I would urge people to think about is we got these numbers by doing these things. There's lots of COVID still out there, enough that people should be worried about. I don't consider 67 cases something to sneeze at. So if I were a citizen, I'd keep wearing my mask. There's no reason to take it off. And certainly if you're going into a store, you're in a crowded place, if you're going to try to enjoy a movie, you should continue to do that because the virus is still here. This is what I meant by saying that, this thing's not over. And you shouldn't be doing we did a victory dance. Everybody was like thrilled when those numbers plummeted this summer. It didn't take 2 weeks before things weren't so good. And so people need to just, if it was me, I know what I'm going to do. I'm going to keep wearing masks as much as I can because why would I take a chance? Just because somebody says you can take it off, why would you do that knowing that this is out there?
And as far as you know, Montgomery County is the first jurisdiction to be able to drop its mask mandate in the region again. I mean, DC has it in place. Virginia, I guess, is a statewide mandate. Prince George's County hasn't gotten this far. As far as you know, Montgomery County is first.
Mm-hmm. That's as far as I know. Sometimes it's good to be first.
Are you concerned in the past, I think, unvaccinated, in many ways, this is an honor system, and you want the unvaccinated to continue to wear masks. That's the guidance. Are you concerned that dropping the mandate will give unvaccinated people a reason just to do without indoors?
Well, they certainly do without inside restaurants. And if you ask Dr. Stoddard what the places where people are most likely to get it based on contact tracing, they're going to say restaurants and retail. So I worry about that, and I will say, because I do go out, restaurant attendance is down. And I've got lots of friends who, if I said, let's go to dinner, and they're like, do they have outdoor dining? And if the place doesn't have outdoor dining, they won't go there. So even though they can go there and they know they're going to be there without masks with lots of other unmasked people, a lot of people are using the good sense to refrain from going there. That's why I encouraged the restaurants, particularly, as some businesses have done, to implement vaccine requirements and just flat out say, you can't come in here unless you're vaccinated, because that way everybody would know that you can go to a restaurant. When you've got the number of people vaccinated we have in this county, and all you do is limit the few people who haven't been vaccinated, or the few thousand people who haven't been vaccinated, they don't get to go into a restaurant. At least everybody else knows if they go in there, they're safe. And so I would encourage people to do that. If we really want to stomp this thing out completely, we need to isolate it as much as we can possibly isolate it. And I would hope that people are willing to, to do that. It would not be a bad thing.
And last question, I actually made up some graphics for use on air using your COVID dashboard for the numbers. And the numbers on the county's COVID dashboard are actually quite different than the numbers that you recited. So the numbers on the COVID dashboard are the ones that are provided by the state, and
Yep.
You were reciting the numbers that you're recovering from the CDC. Is that correct?
Yep. That's the published CDC report. And so we use both. I mean, we didn't take the state number off our website. That's clearly there. We have the other numbers available. It's just the simple fact of the state only counts, vaccinations within the state.
Gotcha. Thank you, sir.
Thank you, Bruce. Next up, it's Randy Bass, WDVM. Good afternoon, Randy.
Good afternoon, everyone. Thanks for taking my questions. Kind of elaborating off of and clarifying based off of some of the answers I heard to Steve's questions earlier. Hypothetically, if we moved back into substantial transmission tomorrow, so at 10 a.m. tomorrow, the new data comes in and we're back in substantial transmission, we have a little backlog and the data jumps again. Does the mask mandate go back into effect on Saturday? I'm not clear here on what would trigger the mask mandate again.
So Randy, looking at the numbers, I doubt that we will move back into a substantial category by Saturday. But as I look at the data and we're trending downward, if that were the case, then I would notify immediately Mr. Elrich and the county council that we've moved into the substantial category. Now I have to go back to the Board of Health Regulation because I wasn't the health officer then. I'm serving as the acting health officer now to look at the language. But based on the language that I see, they will receive, they being the executive and legislative body, would receive notification. If it goes back, my understanding is that it will go into effect. Now, Dr. Stoddard and I have had discussions about that and that recension. So they would get immediate notification that the mask mandate, that we are in a category and the mask mandate should go back in effect.
Thank you for clarifying that. I appreciate that. And I had one more question. It was at the tip of my tongue. Here we go. Going into the winter time, which we saw was extremely deadly last year, we saw our biggest spikes of the entire pandemic during January, December, of last year. What is your confidence level heading into this winter? What is your outlook? How is your outlook different this year than last year?
Last year, no vaccines and high rates. So lots of people for the virus to go to and no protection. This year, lots and lots of people vaccinated and vaccines freely available. There's no shortage of supply. So I think this shouldn't be a repeat of last year, but for certain, as long as, you've got folks who are going into places unmasked, you have risk. And I would say, particularly in the world of business, we're not an island. We know that. About a third of county workers leave Montgomery County to work. About a third of Fairfax County workers leave Fairfax County to work. Where nobody works on an island. This is not island Montgomery. None of these counties are islands. So, we're likely to get people coming into Montgomery County from less vaccinated places, which adds a higher level of risk than simply looking at our own internal vaccination rates. So I'm concerned. That's why I believe, we should maintain the guidance that the CDC has. This is not the time to substitute political guidance for CDC guidance. And if CDC says you hit this range, people need to be masked indoors, that's what we ought to be doing. I don't want to do something and then let it spin out of control. And then we're standing there knowing full well what we know today, that, when this starts spreading and there are enough unvaccinated people, and then we get these breakthrough cases, or even the breakthrough people become problematic. We need to make sure that doesn't happen to the degree that we can.
And Randy, just to add, Mr. Elrich has made a concerted effort to notify counties to get their flu shot. We know that the flu and other related illnesses are the 7th leading causes of death in the county. And so we have an aggressive program where we have flu clinics established for not only our county employees, but for our public. And so when you look at this year, last year, we know that with masks and with flu, we didn't see the level of incidence. Now we have vaccines in place, but we are in fact in a season where we see more respiratory illnesses, and our unvaccinated population is still the highest population at risk.
And I just add to that the flu would complicate anybody who got COVID, because you're already dealing with something that's going to compromise your respiratory system. You add flu on top of that. That's two things your body's trying to deal with. For whether you're vaccinated or unvaccinated, if you get COVID, that's probably not where you want to find yourself. So if I were a resident, I'd get the flu shot, and I'd actually probably just wear a mask, because obviously wearing masks seemed to have an impact on how much flu got around last year.
Thank you both for your answers. I appreciate it.
Thank you, Randy. Next up is Jack Moore, WTOP. Good afternoon, Jack.
Good afternoon. Quick question on an update on the pediatric doses. Could you just run through those numbers again of how many Montgomery County is requesting, how many you expect to receive from the county health department versus the pediatricians versus how much the state is getting? Can you just run through those numbers again?
Sure, Jack. Great question. So we are expecting, based on the ordering process that we put in, to receive about 40,000 doses in the county. That breakdown is 13,200 for our Health and Human Services local health department, and 26,700 which is anticipated, which is about 2/3 of the overall doses going to our pediatricians, hospitals, and other healthcare settings.
And can you tell me, is that for the first 3 weeks, or is that for the first week?
Based on the information that I received last night, that is for the first wave of ordering. Each week will have a different ordering number allocation that we will receive from the Maryland Department of Health. We have consistently placed a higher number for our local health department, Health and Human Service run county sites at 20,000, but we know that the MDH is making the associations based on those providers who have access. The notion is to get more doses in our primary care providers, our pediatric sites, because they are trusted and known sites. Our pediatricians and clinicians are trained to administer doses to school age or younger individuals, and so that is the guidance that we've received so far. If it changes, then I will notify the leadership, but that's the guidance that I received late last night.
Okay, just to connect the dots for me. So the 13,200, that's of the, you all had requested 20,000, and that's what the county health department is going to get, and then additional 26,000 roughly for the other providers in the county.
That's correct.
And yesterday at the Board of Health, council members seemed to be concerned that there could be what they're calling a Groundhog Day with, really high demand initially, and it might outstrip the supply. I'm not sure that we saw that with 12 to 15-year-olds, but is that a concern that there could be, initial really high interest and you just won't have in that first batch enough doses to go around?
That is always a concern based on the access that we receive from the Maryland Department of Health. Again, we requested one number, we received 1,200 doses. So we continue to plan for contingency operations. I think that the first 3 waves will tell, where we are. During the first 3 weeks of vaccinations, we had a nominal start, but then we jumped up to our highest vaccination effort for our 12+ population. During the second week, we had the amount of doses. But again, this is a new vaccine, it's labeled different, it's packaged differently. And so I think that's where the demand may become bottleneck as far as access points, but we're planning as such. The good thing is that we know that we have more doses available in the county, unlike we had previously when we began vaccinating folks back in January.
Thank you.
Thank you, Jack. Thank you, gentlemen. Thank you, Mr. County Executive, Dr. Stoddard, Dr. Bridgers, Director Ortiz for joining us today. I do not see any more questions from the members of the media on the chat. Going once, going twice. All right, I think we're done for today. Thank you, everybody, for joining us. Have a great afternoon. Stay safe.